This Mental Health Awareness Month, clinical psychologists in Australia are reporting a huge rise of clients presenting with social media addiction, keeping people awake at night, of course, the negative impacts of social media also becoming a really hot topic with popular documentary, The Social Dilemma, divining its political divisiveness through echo chamber social feeds. To chat about this, we're joined by Dr. Eileen Allegad, who's a psychologist, also Dr. Karen Sutherland, who's a social media expert. Thank you so much to you both.
Hi.
Eileen, talk
Hi,
to
thanks
us.
for having us.
Absolutely, up to 10% of Australians actually suffer from this idea of this addiction and how it's impacting mental health as well, also leading to depression and anxiety. Talk to us about the difference between normal social media use and an addiction. How do we know?
So normal social media use is probably what most people will be using it for, which is to communicate with their friends, look at what other people are doing, perhaps using it for business, and maybe looking at things for inspiration. So when it becomes an addiction, there is a marked difference in terms of the behaviors, our preoccupation, and the dependency on the use. So it ends up becoming something that regulates us and something that controls us rather than us having that control over it.
Yeah, very much so. Karen, we'll get your thoughts as well. Talk to us about the algorithms that are actually used by these social media platforms. We talk about an echo chamber in there as well. Does it kind of become addictive? Obviously, social platforms would be sitting there saying, how do we get users to not leave? A little bit like the pokies in a way. Talk to us about how they use algorithms to become addictive.
Well, I mean, most of the social media platforms actually reward you for how much time you actually spend on them.
Yeah.
So by spending and being active and interacting with other accounts, they will show your content to more people. And so it's this two-way interaction that actually trips the algorithm and provides more reach for your content. So, I mean, if that's the case, every time you get on there, you're interacting with more people, you're getting more likes. I mean, I know Instagram has pulled back on the likes, and Facebook as well, but you can still use their desktop versions and see it all. So there's that reward you get for spending time on there, and of course it becomes addictive, particularly if you've posted something and people are going back to see how it's performing. And there's been like a report that came out to show just only 30% of Australians actually use social media for work, but we're
Really?
spending an hour and 45 minutes on it.
Yeah. Well, I mean, that's the idea of it, isn't it? And I don't know many people who use TikTok for work, but there certainly are other things as well. Eileen, I think many of us find ourselves just not being able to turn off at nighttime. And even though mobile phone companies like, I beg your pardon, like Apple have come up with ways to turn our screen yellow and things before bed, the fact is the content on there is quite often the thing keeping our mind ticking as we're going to sleep. And I think probably I'm not alone in saying that we often pick up the phone after we've put it down just to see if there's anything else we've missed a bit later on as well.
That's right, and I think the way that these social media platforms work is that the more you use them, the more you want to use them. And so, even if you were scrolling or checking before bedtime, what that does is that it then becomes a struggle, or you're wired but you're tired, and you kind of can't really control that urge to want to check.
Mm.
It does activate specific types of the brain that releases dopamine and makes us feel good, the same way that substance abuse or gambling does. And so there is a part of it that is neurobiological and that we don't have control over, but what we can have control over is making decisions to set boundaries. For example, what you said there, leaving the phones outside of the bedroom if it is bedtime.
Yeah, it's a really good point. And just on that, Eileen, as well, do you think it's something that perhaps, we have to have rules in place for? Leave the telephone outside of the bedroom is one that we often hear as well. But I mean, I'm a journalist, I do that, and a massive story could break and I'd never forgive myself. I'd rather the lack of sleep in some ways as well. You find that there's a fear of missing out.
That's become larger now than it has ever been in society, because if you think about it, before, the ways that we found out what other people are doing are through traditional ways, whether that's like a phone call or maybe just through bumping into people when we found out we weren't invited to something. So part of
Mm.
the addiction could also be the fear of missing out
Yeah,
and wondering what people are doing and
yeah.
constantly checking on sites of other friends and family and feeling as if we're not included. And so there is a psychological impact, whether that's anxiety or depression, whether I'm liked, I'm not good enough to be in these events. And so that now creates another layer of psychological distress that we never had before social media.
Yeah, it's so interesting. I don't know if you've both seen that episode of Black Mirror where everyone's walking around with their mobile phones rating each other out of 5. And that's how we decide our social interactions these days as well. Karen, just as we finish up, I want to get your thoughts on this and how companies are essentially using our addiction for social media at the moment as well for their own gains. You and I do a segment once a week talking about social media for business too. But when it comes to this addiction with social media, and we're not just talking about teenagers, are we? We're talking about people right across many different ages and also business owners who it also falls into that fear of missing out.
Oh, absolutely. And I mean, I guess the idea of approaching social media, using it as a tool with actually having a purpose for what you're doing on there, has sort of gone out the window. So when we're not doing other things, we're sort of checking all the time. Actually having a task to immerse ourselves in is really hard. And research has shown it can take up to 20 minutes to get your concentration back on a task after being distracted by it. So, it's really important to try and, I guess, approach it and learn a bit of digital literacy or social
Yeah.
media literacy as well, and teach that to our kids.
Absolutely. We've got 1 minute left, Eileen. I just want in that time, if you can give us 3 practical tips we can do to try and avoid having our social media obsession.
Absolutely. So I think the first one, as it's already been mentioned, is to be clear on your intention of why you're going on the sites. And
Right.
so it makes sure that you know why you're there. And so therefore you can set boundaries.
So you figure
in
out why
terms
you're
of
there,
what
and
you're-
therefore you can have a bit of a time limit for yourself as to when you know to switch off.
That's exactly right. So, and then you can put the limits around that, because what will be appropriate according to that reason. The
Yeah.
second thing is to try and have detox days. Try to have days where you turn off the notifications, and not that you can't go home later on and check it, but it stops interrupting your day, and you can actually engage
That's a
in
great
whatever
one.
it is
Like
that you
delete the app for a day or just switch it off so you don't have that muscle memory of finding it. What's the third?
The third one is to find alternative ways to relieve stress or entertain yourself if you're bored, or connect with people in traditional ways. I think people
What?
now
Human
don't make.
interaction?
I know. It's like, isn't that weird, right? Like we're really wanting human interaction like the old-fashioned way.
Yeah. Awesome. All right, Dr. Eileen, Dr. Karen Sutherland, thank you so much for your time. Appreciate it.
Thank
Thank you so
you.
much.